Hello, this is Marshall Riddle from MCUL, welcoming Sander Domaszewicz, Principal, Mercer. Thank you for joining us, Sander.
Thanks, Marshall. Well, appreciate the opportunity to present to the Managed Care Online Future Care webinar. I forget what year this is, but we've been doing it for quite a while, kind of guiding the marketplace along. Today we have a few things to share, and hopefully you all have the material in front of you. If you flip over to slide 1, you can see that we start our thoughts and our insights where we often do, and that has to do with what's the rationale for change and why is the future going to look different in terms of employee benefits than it does today. And I think this slide does a pretty good job of delineating why that change has to happen. And the top line there represents the accepted benefit increase that employers have had in terms of their cost increase over the last 20 or so years. And you can see there's been a lot of variability in previous decades, but we've been doing pretty good the last 5 or 8 years here with a relatively flat trend, fairly budgetable in the 6% range. 5.7% actually for 2002 expected, and 6.1 was the actual for 2011 actual. Now that's the accepted benefit increase, but that's after employers have made changes. So they've already eliminated high-cost plans. They've already done some cost shifting to employees through benefit design, raising deductibles, copays, et cetera. The actual number that starts off at is closer to 8 or 9%. So that may be wonderful news relative to some historical gyrations that you can see there. But the 2 lines down below are really where our pain points lie, and that's that worker earnings and inflation and other economic indicators are not near at the level that we're seeing for healthcare cost increases for employers. In fact, they're 2 to 3 times more. Unfortunately, the sustainability of that it gets eaten up in a hurry, and that differential is causing pain not only for employers but for employees. And then if you flip over to the next slide, on slide 2, I think that this is I'm sure you've talked a lot about healthcare reform within your organizations, but healthcare reform to employers, there's some good components to it, and I think that there's some things that they're thankful for and happy that exist, but there's a lot of pain points as well. And here, we have what are the areas that employers have significant or very significant concerns about, and you can see that the 3 on the right are in that 20 to 30% range in terms of significant to very significant concern. So depending on what type of an employer you are, the 60% plan value may or may not be an issue for you. And the auto enrollment feature may or may not be an issue for retailers. I can tell you, with a lot of folks that have opted out of their plans, that's going to be a crushing burden for them to have to auto enroll folks. But on the far left-hand side, and I think this makes a lot of sense, and this is the burning platform, the common denominator is that half of employers are extremely worried, and the other half probably should be, about the potential 40% excise tax in 2018. Now, whether that comes to play exactly as it's kind of billed or changes, it's really driven by that gap between, what's the cost increase on healthcare on the prior slide, and then what is the CPI that folks are experiencing. And whether you hit that excise tax in 2018 or whether it's 2020 or beyond, every employer is going to hit that at some point if it continues the way it's been legislated. So that's the pain point that everyone's trying to solve for, and they're really trying to do that in 2 ways. So the future care that we see from the employer benefit plan sponsor side is they're really trying to solve that equation in 2 major ways. One is on the demand side of the house. They're trying to encourage wellness and health and to keep healthy folks healthy, and those that are ill to try and get them the most efficient care management that they can to help manage their chronic conditions. So that's kind of the wellness health management bucket on the demand side to reduce the demand for health care. And then if that side fails and folks actually do need to go seek care, when they're out buying health care services and they're spending money, theirs and then the company's money, the supply side of the equation is how do we get people to the right care at the right time for the right price with the right outcome at the right provider. And I think that's being done in a number of different ways beyond the health management. It's being done with trying to steer folks to efficient networks. It's trying to encourage medical travel or centers of excellence. It's creating narrow networks. It's using consumer-directed plans to get people to understand cost and quality and transparency, reference-based pricing, and a number of other tactics that are really trying to get the most out of the most health care for the dollar spent when folks do spend money. And if you start flipping down to slide 3, we'll start talking about some of the tactics that employers are adopting. The first here, that I want to highlight is that retiree medical, is still going by the wayside, continuing that downward slope. And the challenge that employers have here is that it's not just about keeping a healthy, productive workforce, but it's worrying about your total rewards and thinking what your total compensation looks like. And as employees become more aware that, eBRI and Fidelity have said you're going to need $150,000 to $250,000 to pay for your out-of-pocket medical costs, even if you're retiring today, that number's only going to go up. Medicare is probably not going to get any richer than it is today, and employers aren't sponsoring these plans anymore. That total rewards package is something that employers are very worried about in terms of how are our folks going to be able to retire. Will they be hanging on for medical coverage when they don't really add a lot of value to the organization just to keep their medical coverage, and will they be able to retire on time? So some of the solutions that we see on the next page, as we flip over to page 4, you can see that CDHPs are coming into their own. You can see the kind of the modest trend from 07 to 2010 as that increases over time, both on the employers offering CDHPs and the employees' percentage enrolled of all employees. And then you can see this big spike in 2011 because now we've got a burning platform, right? Now we've got a reason for folks to take action and take action quickly now that they know that there's significant challenges ahead with meeting some of the healthcare reform requirements. And that's obviously magnified much higher. This is for employees with 500 or more employees. So this is getting down even into the smaller and fully insured groups now. We're seeing significant, 1 out of every 3 employers offering a CDHP. For larger employers, the 1,000 plus, the 5,000 plus, and of course our jumbos, the 20,000 plus, those numbers are significantly higher. About 2/3 of jumbo employers are considering or offering CDHPs. And then the other side of the equation, is why are they offering that? If you flip over to page 5, you can see that there's a huge cost differential. PPO versus HSA, about $2,000 differential there, 20% less. Now that number includes selection, so that's HSA plans that may be taken by folks that are healthier or realize that they may need less care than folks that take PPOs or HMOs. But it also does include the HSA contribution from the employer. So take that with a grain of salt. What that doesn't mean is that you take every employee in the PPO and move them into the HSA. You save $2,000, but there is significant, meaningful opportunity to kind of help control cost here. And blowing that out a little bit further on page 6, you can see on the left-hand side, we've got more and more employers thinking, gosh, do we want some of our employees in that more efficient model, or do we want all of our workforce in that more efficient model? And full replacements are on the rise significantly. You can see HRAs are a little bit easier to get to with full replacement than HSAs, but they do generally generate less behavior change and less change in cost. So it's kind of a trade-off there. The right-hand side really elaborates on the cost slide that you saw earlier, and I think it points out some really important features. One is, remember the selection issue we talked about the page before on page 5. If folks are doing a full replacement with HSA plans, including the employer contribution to the account, the average employer cost is $7,700. And you can see that that's higher than the $7,500 that we showed on the prior slide. But what that tells us is that selection, there's no selection in a full replacement for the most part. We're kind of putting everybody in the same bucket. They all have access to the same kind of plans, and the costs are still significantly reduced. The other marker on there is that the bottom right bullet, that high deductible plans, just catastrophic plans that aren't HSA compatible, still cost $400 more than an HSA plan. And of course, those catastrophic plans that have high deductibles don't have any employer contributions into an account because there is no account. So that there's definitely some behavior change and some other features going on here with folks that are offering HSAs to help meet those challenges, cost challenges and quality challenges that employers are trying to get to. On page 7, we are seeing a nice halo effect with more and more employees enrolling in these plans. About a quarter of employees are enrolling in CDHPs when they're offered as a slice option, you can see on the left. And then, of course, that's driven a lot by how you design the plan and what the value prop is. And the right-hand side of this slide on 7 just tells you that if you design a plan that has a meaningful value proposition for employees, for instance, putting in more than $750 into the HSA, a lot more of them are going to take that deal than if you don't put any money in at all. Kind of a no-brainer. Slide 8 continues to track and monitor the ever-rising increase of incentives for folks to participate in health management. I think this is a tidal wave of activity, and oftentimes they're putting the money into health accounts. You can see those numbers growing substantially year over year on page 8. And then if you flip to page 9, you can see how those incentives are being delivered. Finally, lower premium contributions has taken over cash and cash equivalents, like gift cards, as the most popular type of incentive delivery mechanism. Not by much, but by a little. And you can see that there's a growing, and I think these will continue to grow meaningfully over the next 3 to 5 years, contributions into health accounts for incentives, so HRA, HSA, FSA contributions, as well as plan design and integrated designs that have to do with offering value to folks for doing the right thing. So can I get the better plan design if I do the right thing? On page 10, it's a slide just to indicate incentives do work. We know that folks that offer incentives are getting a lot more engagement, a lot more participation in the whole array of health management offerings that they have. But you can see that health assessments are a heck of a lot easier to encourage folks to jump into when you're giving money with incentives. Lifestyle management and disease management shows some impact in terms of the uptake with incentives, but they're much more longer-term plays. They take a lot more commitment than they do motivation. Health assessments to complete a 10-minute health assessment, really motivation, whereas on the disease management and lifestyle coaching areas, it takes a lot more commitment to kind of follow through and change those behaviors long-term. So I would try and right-size and balance that out as employers think about adopting incentives to health management. And wrapping it all up, I mean, I guess, that the future that we see, in addition to kind of configuring yourself right for healthcare reform and any potential exchanges, as well as, how retail health plays into all this, is that employers are going to take a page out of the playbook from the last decade and say, gosh, consumer plans were nice. We had offered a CDHP where people check the box, they've got a pulse, they sign up for the plan, here's your $500, good job. And that was really the version 1.0 of CDHPs, the configuration in the last decade. And now with healthcare reform and I think some of the other components that we have coming online, we're really adding that yellow box on the far right, which is let's use those same CDHPs to try and impact the supply side of the equation. And at the same time, let's integrate in some value-based design components as well as incentives. So you might get $250 just for signing up, but you're going to have to earn the other $250 through healthy activities and doing the right thing. And we see that only expanding and kind of being a mainstay in all employer plans, both fully insured and self-funded. So with that, good luck and go into the future boldly. Make sure that you meet your partner and your client expectations and you partner with them shoulder to shoulder, because the organizations that do that are going to be the ones that win in terms of market share and continuing to hold the clients that they have going forward. And have a wonderful day.
Thanks again, Sander. This presentation is complete.